Hello guys, my name is Chun-Gyang. I'm a medical doctor in the field of respiratory medicine. So I want to talk about um, an inhalational device that we use in treating asthma. Okay, so medications or drugs can be administered via several routes, to patients who have asthma. The inhalational route is the one of the major routes in delivering these medications in asthma. And this is because it goes straight to where you need it to work in the airways. And then, it comes with fewer side effects than when you use other routes. It also has rapid onset of action. Now, there are several inhalational devices that can be used. This is the pressurized metered dose inhaler, and this can, be used, in treating asthma to deliver medications. There are other devices such as the dry powder inhaler, the soft mist inhaler. Now, the advantage of this is that it is very portable and handy, but then it can be very technical. So, if you don't use it correctly, the patient may start to feel that, maybe something is wrong, my diagnosis is not asthma, or something, so they could, they may not become, remain adherent, and the asthma may continue to become poorly controlled, and they keep having flare-ups or attacks. So it is important to emphasize the technique in using this inhaler. So at every point in time that a patient comes across a healthcare worker, there is the need to emphasize the use or the appropriate use of this inhaler. How do you use this inhaler? All that you need to do is to be sure that it is not exhausted. So this you can do, shaking. You could actually, hear the medication inside the canister, right? This is the canister. You follow just some simple steps, So the patient sits upright. You have your inhaler upright like this, okay? Okay. Now, if you notice this, there's a groove here, okay? So that's where your thumb should be, so that you can sit upright like this. This finger can be on this canister, bottom of the canister, and whenever you compress them, you press them, you have the inhaler come out, through this vent, this opening here, which is where the medications, comes out of and into your mouth. This is the cap again, like I said. So, again, the step starts with you holding your medication upright, shaking vigorously, okay? And then you exhale out away from the vent, then put this in your mouth. Now, at the point where you're inhaling, you press to release a puff of the medication, right? So it goes into your mouth at the point when you're inhaling, right? So that's synchronized inhalation and actuation is the main technique that most of the time is not gotten well. So it delivers the medication with your inhalation. Now, the next step is that you hold your breath after inhaling deeply. You hold that breath for 5 seconds or for as long as you can. Okay? Then you now slowly breathe out away from the canister or the inhaler. Okay? In your cap, and then you're done with the steps. But if you want to give yourself another dose of the medication or another puff, all you do is just repeat the steps. Okay? So this is all that is required, in the technique. Thank you for following. I hope that this was informative, and I hope that you look forward to seeing more of this educational series. Thank you, and see you again.